Good evening from Colombia. My name is Juan Evangelista, Tercero, Gaitán, Buitrago, and I am a psychiatrist from Colombia that was formed in Argentina. I am now the head of the scientific committee of the Global Psychiatric Association. I want to thank you all in the name of the Global Psychiatric Association for assisting to this event that has been the fruit of a long and arduous work from all the members of the Global Psychiatric Association. I want to give my special thanks to Rainer Hume for reuniting us here in this event that aims to bring the foremost talent around the world in the world of psychiatry and mental health. Today I am going to talk about musical therapy in dementia. Allow me to share my screen. Musical therapy in dementia is a very interesting and rather new concept that brings musical stimulation directly to the brain through occupational therapy and works as an adjunct to current developments and treatments in dementia healthcare. Of course, this might sound for some of you like a novel treatment or a new way to do occupational, social, and psychological therapy, but it's a part of current practice and has been, like in this movie, and I hope that you know it, Coco from Disney, it's been a concept that it has been present in the care of the elder people for a long time and unknowingly has become a part of popular culture. Given this specific example, in this scenario, you can see that the little kid helps his grandmother to remember her late father through a musical piece that he composed for her. And in essence, this is one of the many aims of the musical therapy approach, helping the elder people with dementia to cope up with conflicted emotions and to placate behavioral disturbances via musical stimulation. Okay. For those of you that work with patients with cognitive decline or dementia, what's the real problem? This is a concept that can bring a very complex discussion between academics. Is the pathophysiological changes of cognitive decline, which is a very complex issue because there are many types of dementia with different pathophysiological changes, each one being the target of a very active research. Is the selection of pharmacological agent. In this regard, we have a limited amount of medication that we can provide the patient, and there is no single answer. There are many ways to pharmacologically treat a patient with dementia, being anticholinergic inhibitors the first line of treatment. Is it the speed and rate of cognitive decline in the patient? Is that the real problem in dementia in practice? Well, the answer is no. None of these very real and genuine problems are the main issue with dementia healthcare in practice. The main issue that will bring your patient to your consult is the challenges in the daily interaction between the patient and his or her caregiver. In my experience, in my daily experience, and as a dementia and cognitive decline specialist, the number one cause for demented patients to come to my consult is because they are brought by their caregivers, mainly because of the behavioral disturbances that they may present in varying degrees, I assure you. Now, how can music therapy help with these patients? Well, given this scenario, we must think about music therapy as a neurobiological intervention, as a social work intervention, helping people to interact with each other and helping to create an optimal scenario for the caregiver to share experiences and time with the patient in a very positive way. And it also works as an occupational therapy intervention. Now, Alzheimer's disease does not typically involve areas that relate to implicit musical memory functions. An activation of the default mode network is heavily involved in memory preservation and is a target of musical therapeutic interventions. In practice, how do we translate this? In this case, musical appreciation and musical memory functions are the least impacted by Alzheimer's disease, and it's only absent in very late stages of the disease. The late stages of the disease are not the most difficult ones to deal with by the caregiver. And thus, musical therapy as a neurobiological intervention will help the patient and his caregiver in the most difficult stages of treatment and coexistence. Social decline is a very, very common finding in dementia patients, and group-oriented music therapy enables the patient to engage in a social activity. Also facilitates communication, experience sharing, and involvement of the primary care group in a positive experience, as I already told you, allowing the caretaker to interact with the patient in a symmetrical way. As a social work intervention and given the proper caregiver characteristics, it might become a very enjoyable experience by both the dementia patient and his caregiver, allowing them to have a little chat about the moments that they lived together regarding the musical piece being played. They can also bring back experiences, memories, and positive experiences regarding the piece being played. Also, let's the caregiver and the patient to share a positive experience, not influenced by a behavioral disturbance or the forceful implication of our routine. Now, as an occupational therapy intervention, it's a very good way to moderately introduce physical well-being, physical exercise, and education. Also, it helps people with dementia to have a heightened sense of position and self-control. This, in turn, allows them to minimize some environmental risks associated with the motor decline, associated with some forms of cognitive decline. Also, helps them to engage in purpose-oriented activities and lets them be empowered in decision-making and the quality of the interaction with the caregiver. Now, which options do we have regarding music therapy? We have group interventions, like scheduled group singing sessions, musical discussion, group music playing, And in individual interventions, we have facilitated singing, musical routine building, and family interventions. Regarding group interventions, scattered group singing sessions can be done in an indoor patient scenario, where many patients that share common characteristics of age, cultural influences, and upbringing can share a social experience based on a routinely scheduled session for them to sing. Of course, there is no need of the patients to be highly talented in singing, but the fact that they engage via singing or playing music or following the rhythm of the songs they already know and learned in their youth helps them to interact in a social way. Of course, given the proper circumstances, the musical discussion of the pieces they already know in cultures where musical experiences are heavily influenced by a cultural standard might help them to engage in a social activity that helps them to integrate themselves in a socially acceptable way. I want to cite the example of Argentina, a country most known for the tango. Tango is a musical genre that it's really complex, has its own language, lunfardo, and is shaped by the individual and social and cultural experiences throughout the years, according to the composer, the author, and even the, the singer themselves, the instruments that they were being used, and the cultural background of the piece, the recreation, and even the moment of the execution. There is a tango culture in Argentina. And in patients and elder patients that are not knowledgeable about tango, they have a very vast array of pieces, cultural experiences that they can share, discuss, and even enriching themselves, given the complexity of the genre and its impact in local culture. Group music playing, it's a rather complex and more advanced way to do musical therapy in group interventions. Has some hurdles because it depends on having some of the patients be somewhat talented at playing a musical instrument. But to be clear, there are many options for patients with not so developed musical talent, like following with their palms, following with drums, or simple exercises of rhythm. Regarding individual interventions, we have facilitated singing. The provider of musical therapy can help the patient to understand the context in which the piece that is being sung interacts with the patient's personal history. And the musical routine building, it's part of making a chronogram for the patient, generating expectations. Of course, family interventions are very important. Family interventions in musical therapy allows the caretaker and the family to engage via shared musical experiences with the patient. Normally, this will take the patients to reminisce about previous times, most likely when other family members were sharing with them in a positive way. Now, to plan a musical intervention, The provider must interview the patient and his social network regarding individual preferences. Of course, musical experiences are very vast, and even the same song being played with a different rhythm might elicit different emotional responses. It's paramount for the musical intervention to have a clear view on the patient's individual preferences. Of course, preferences in musical taste might change as the development of the patient himself throughout life. It's very important for us to know in the younger days of the patient, in the different phases of his life cycle, which could have been her or his preferred musical genres, musical tastes, or specific pieces. This depending on which emotion, which memories we want to evocate in the patient during the musical intervention. Now, there are key moments in the life cycle with a deep emotional involvement, like the song that was played in the patient's first date with his now wife, or the piece that was played in their first dance when they got married, or the lullabies that were sung by his or her mother when the patient was little. These key moments and these key musical pieces are very important in a musical intervention, and given, for example, a behavioral disturbance or a moment of heavy or very severe temporospatial disorientation, playing or singing a key piece might help the patient to regain her or his or her self-control, or to contain the emotional disruption. Okay. There are musical preferences in all of us that are related to specific mood states. Many times demand that we accompany them with some specific kinds of music. Also, negative experiences, negative situations are linked to specific musical genres or musical pieces. For example, family reunion, full of merry, full of joy, full of positive emotions, normally is not being accompanied with somber or slower music. Normally, pieces which are played in lower keys have the tendency to evoke negative emotions. And this is very important in order to set the desired mood in the intervention. Of course, it's very important to be aware of the experience that a patient might have playing a musical instrument or having specific artistic talents. We need to know if the patient can play the flute, can play the piano, can play the guitar, because if there is a chance that the patient is proficient in a specific instrument, it might give us wider horizons in musical interventions. Of course, religious beliefs are very important in musical therapy. Later, I will talk about a patient that I am treating, where the Gospels sung at the Mass is a very Catholic patient, help him to contain his behavioral disturbances and help him to contain his emotional dysregulations. This is the patient I am talking about. Right now, he is 81 years old. His cognitive decline started at 70 years old and started with spatial disorientation and memory amnesic failures that were progressive and respected reboot slow. This patient was previously a farmer. His family, worried by his advanced age and the fact that the farm was very far from any clinic or any populated center, made arrangements to move the patient to the downtown, to the city. In the city, he did not have as many occupational options as he had when he was a farmer in his own farm. And cognitive decline started advancing more rapidly, and behavioral disturbances became quite notorious. In one of my domiciliary visits, home visits to this patient, I noticed that there was a TV show being played at the moment. This show is called Serenata, and it played a specific genre that it's called bolero. Bolero is a genre very popular in my country among older people, and it's mainly consists of romantic songs or songs that relate to the experiences of living in a rural area. This patient that was very, very prone to developing psychotic disturbances and behavioral disturbances, heavy behavioral disturbances, and aggressive behavior, was enraptured by the music. And in this visit, I noticed that he, who has a very noticeable memory loss, started singing his favorite songs. He specifically identified a song that was played when he got married. He then proceeded to sing this song for a little while and invited his wife, who had a very heavy caretaker load, to dance in the living room. This took us by surprise, specifically his wife, because they hadn't danced in a decade. And his behavior was, in her words, the same as the behavior he used to exhibit when they were younger. Of course, I was very interested in this new experience with this patient, whose care was really difficult because of the behavioral disturbances, the tendency of wandering and getting lost. This patient, when was exposed to this kind of music, started talking about his past in a very positive light. His mood overall improved more than was managed with more traditional interventions. Of course, by evoking positive experience of the past, he even invited us to his old farm for a visit. Being aware that he didn't live there, he took us in a tour where he talked about all his childhood in this place. How did he meet his wife, the experiences that he had raising his children, and even told us how hurtful, how a negative impact he had when he had moved to the city, because he was a farmer that specialized in apiculture, in the raising of bees for honey. and with vast empirical experience in this area, he even taught us some key pointers of his previous job. Of course, the patient would quickly forget about these events because of his memory loss. And some days he didn't even recall having been there in the first place. But with continuous exposition of these sessions, taking advantage of the history of his personal history related to music, he started to be more open to talk with his caretaker, his wife, even started calling his sons, and also his overall behavior improved quite significantly, turning him proactive in doing housework. Last but not least, musical therapy is a great complement for dementia treatment, but of course, it's not meant to replace proper pharmacological and psychosocial interventions. Yet, it's my duty to tell you that it's a very cost-effective method of treatment and does not exclude any other kind of intervention, of course, if it's evidence-based. We have to be mindful of the limitations of the dementia patient. We have to be aware that not all the patients are willing to engage in musical interventions, and a very careful approach must be performed with these patients. We have to be aware that the patients might get easily tired or overstimulated with some types of musical therapy, and the provider of this therapy must be trained to select the pieces and the musical sets that are more appropriate to the mood and the overall predisposition of the patient. Of course, we need to be very respectful of the beliefs and preferences of the patient, and we really need to be in a constant, very open and vast communication with the caretakers. Musical pieces are not just pieces to be listened to, but normally they imply a heavy history. The meaning of the lyrics can impact the understanding of the patient of these lyrics and the mood that sets when the musical piece is played. It's very important when selecting specific musical pieces that the provider is well informed on the author, his or her works, and the relation that the piece, song, and the time of publication had in the history of the patient. And we need to correlate it to the life cycle or the experiences that were being lived by the patient in such a time. Okay, that's all for now. I want to thank you all for listening to my presentation. Of course, I want to offer you the channels on which you can contact me, so we can share information, experiences, and of course to receive some feedback from you all. And please make sure to join the Global Psychiatric Association at https://globalpsychiatricassociation.com. I want to thank Rainer Hune for a huge effort that he is doing to put this event together, and I want to thank all the speakers and all the staff that helped us to make this Congress become a reality. Regrettably, because of some personal situations, I wasn't able to connect to have a live interaction with you all, but I hope you the best, and I hope this brief introduction to musical therapy in dementia has been to your liking. Thank you very much.